This is a video about a broken wrist, which for most people might be just about the most boring kind of video they could ever watch. However, if you are the kind of person that enjoys doing activities like these, and then one day, when doing something like this, you go over the handlebars, resulting in an injury like this, which makes you feel like this, then this might be exactly the kind of video you watch in order to get an idea of how other people's recoveries have gone, which might give you an indication of how your recovery might go. I broke the ulnar and radius bones in my left forearm, and I basically broke the ends of them off, and then I also broke the scaphoid bone, which is a smallish bone between the wrist and the thumb. So the format of this video is essentially a series of clips taken at various times during my recovery, and hopefully if you have a similar type of injury than what I suffered, this video will be of interest to you. So here we go. So right now what's happening is the scar is healing. It's looking not too bad, and the swelling is going down. When I first took the cast off after the surgery, which happened about 2 weeks after the surgery, the arm was far more swollen than it is right now. You can still see it is swollen, but it certainly has gone down a lot in the last 2 weeks since the cast came off. The other thing is, you might be able to see there's some bleeding here in the forearm. The reason for that is because for the first 3 weeks or so after I broke it, I had to walk around and hold the arm in this position the whole time to allow the swelling to go down, and I guess some of the blood flowed down and deposited in the forearm over here. It also resulted in Marin calling me a teapot incessantly, which was very pleasant. The other thing that was somewhat alarming was my forearm. Lost, first of all, some of the muscle bulk. I'm not sure if you could tell with the fisheye lens, but the left arm lost, I guess, size compared to the right, and also the texture changed. It lost a lot of its firmness. Some of that firmness has come back now that I can actually move the fingers and use these muscles again, but the right forearm is, as it always has been, reasonably firm, but the left forearm definitely lost a lot of that firmness, which was somewhat of a concern. The other thing is the range of motion. The right arm obviously has all the full range of motion it always has had, but the left, at about the 2-week mark, the fingers couldn't close much more than about that. They can now touch the hand, but cannot reach to the middle of the hand. So that range of motion is still coming back, and as I try and close them, it causes quite a lot of pain up the inside of the forearm over here. The other one is the thumb. Obviously the right thumb can do everything it always could. The left one, it's improved quite a lot in the recent days. Every day you can see improvement, and this joint now is able to flex, although not to the full extent. The one range of motion that I've lost, which is probably the most alarming, is the ability to bend the wrist or the hand backwards at the wrist, and the left one, it won't go at all. It kind of just locks at that point. You might think I'm not actually trying to move it back, but I am, and it won't go any further back than that right now, which is quite alarming, because if I don't get that back, I'm not going to be able to, well, ride a bike or do a lot of things, I guess. So the other range of motion, which is still very much reduced, is the left to right of the hand, and as you can see, that's got a long way to go. The twisting range of motion, that's not too bad. It's coming back a little bit, and interestingly, when I do this motion, the area it hurts most is over here, which is where the end of the ulnar flaked off. So I think that's pretty much everything there is to show at this point. So it's just over 2 months since the surgery took place on my left wrist, and here's an update on how the recovery is going. So the left wrist is still a little bit swollen compared to the right, and the range of motion is coming back. It's improved. It still is having trouble moving backwards in that direction, but as you can see, it's much improved. At the 2-month mark, it's able to go back that far, whereas at the 1-month mark, it was only able to extend to about that point. So that's improved quite a lot. The left to right range of motion is still also substantially reduced compared to the right, but it is improving as well. And then the bending down range of motion as well is still reduced, but as you can see, it's coming on. The ability to form a fist has pretty much returned to normal. So I'm able to squeeze it fully, and then the thumb as well is pretty much back to normal. So that's good. One thing I didn't mention at the 1 month mark was that at that point in time, the left wrist was almost permanently warm to the touch, noticeably so compared to the right. But now the left wrist has pretty much returned to normal temperature, except if I'm out in the cold, then the left wrist has a tendency to stay warmer, while the right one, I guess the blood is drawn away from the skin and the skin is cold to touch. So that's pretty much where we're at the 2 month mark. The scar is slowly getting better, although it still is a bit more of a daily bother than I would have liked. You can actually feel it, and it's actually under the skin. You can feel there's quite a bit of scar tissue, which is obviously something that you'd rather not have, but that's where it is right now. The swelling has pretty much gone down. You probably won't be able to notice it on the camera, but the left wrist is still a little bit swollen compared to the right, and I'm told that it'll take up to a year for the swelling to disappear entirely, so we seem to be pretty much on track for that. Most importantly, the range of motion is pretty much back. It's still sensitive, it still feels like I've got a soft tissue injury when I move it through the full range of motion, and the range of motion I was most concerned about was bending the wrist backwards. You can see if I try and bend it back just with the muscular movement of the wrist, it is painful, but then if I give it assistance by pushing it and not relying just on the muscles, then it's looking not too bad. So it does have still a ways to go from a range of motion point of view, but it is improving. Hopefully I'll still see some improvement in the next couple of months. So the scar is still quite a problem. It's kind of pink and raised compared to the skin around it, and that is still quite sensitive, but I am sleeping every night with a silicone strip on, which apparently is meant to decrease the sensitivity of the scar, and I just hold it in place with this bandage, and that does actually seem to be helping decrease the sensitivity. The other thing is, as you can see, I'm in shorts, which means I'm riding my bike to work, and in fact the other day I even jumped off a curb on my road bike, or commuter bike I should say, and it was a little bit painful but not too bad, so that's a good sign. It seems to be improving, and I'm told I've got to keep just stretching it like this and pushing it down on a table and holding it up, and that'll eventually improve the range of motion and help the biking even more. Okay, today is October 18th, 2011, which makes it just over a year since I broke my wrist and had surgery to repair the break. And it is also just a couple of days before I go in for a second surgery to do a few things. Number one is they're going to remove the scar that has been left behind from the first surgery. I'm not sure if you can tell, but the scar, it's almost non-existent at one point along this line. Above that non-existent point there's just some very minor scarring, and then down the bottom here the scarring is really significant, and I believe that's from where the wound wasn't stitched properly after the first surgery. It opened up under the cast and then ultimately formed this really significant scar, and I don't really care what it looks like, but it's really sensitive to touch, and if I get the scar caught on a zipper, or I rub it on the side of a desk, or accidentally brush it when opening a cardboard box, it's really quite sensitive, and so removing the scar is one of the main reasons for having the surgery coming up this week. Second reason is apparently inside there's a little fragment of bone which might be resisting my range of motion for lifting the hand upwards, and they suspect that if that bone is removed the range of motion might improve slightly. And the third thing they're going to do as part of the surgery is to remove the hardware. There's a plate with some screws in it on the end of this bone that runs along here, and that is going to get removed. There'll still be a pin left behind in the scaphoid that'll stay, but they will remove these the pins here. But as I say, the main issue is actually the scar, and hopefully once that is removed I'll be able to wear a watch and things like that, because right now it's even too sensitive to wear a watch. In terms of an update on range of motion and things like that, there hasn't been too much improvement since the 4-month mark. I'm not sure if it's noticeable on the camera, but the left wrist is still slightly swollen compared to the right, and the range of motion is still reduced. The significant range of motion that I'm concerned about is the one that bends the arm upwards, because if you want to do a push-up, or if you are falling down to the ground and want to catch yourself, that's the flexibility you need most importantly. The downward flexibility is also reduced, but I'm not too concerned about that. And there is still sensitivity and pain at the extremes of the ranges of motion. And the other kind of somewhat amusing thing is, if for example you washed your hands and you want to dry your hands, and just by shaking them dry, the right wrist obviously still works like it always has, but the left wrist, I can't shake it in that manner. It's painful, and just doesn't really want to shake in that way. So it's kind of amusing to not be able to do that, feel like you're somewhat uncoordinated or whatever, but it's painful and just doesn't have the flexibility to do that. Hopefully that'll improve after the surgery, but it is a year since the original break, and it's kind of a soft tissue sprained ankle type pain, which I guess may never go away. But overall, the wrist is not too bad. I'm able to mountain bike and kiteboard and do all the things that I did before I broke it, but it would be good to have a bit more range of motion, and also to get rid of that sensitivity on the scar. So that's the hopeful outcome, I guess, of this next surgery that's taking place in a few days. Okay, it's now 2.5 years since I broke my wrist, and about 1.5 years since I had the second surgery. At the second surgery, they took the plate off the end of the radius and removed the screws holding that plate in position. They did leave behind the pin that was in the scaphoid. Another reason for the second surgery was to remove this large scar that formed after the first surgery, and I was hoped that the scar after the second surgery would be quite a lot smaller. Unfortunately, that wasn't the case, and the scar after the second surgery was about 90% of the size and about 90% of the sensitivity in terms of the sensitivity problem of the scar after the first surgery. Since then, I did have a range of cortisone injections. I had 3 sets of cortisone injections spaced at 2-week intervals, and although those injections were quite painful, they did improve both the size and the sensitivity of the scar. I'm not sure how well it shows up on the camera, but the scar is smaller than it was after the first surgery and less sensitive. I haven't actually started wearing a wristwatch on my left wrist, but I think that the scar is now not that sensitive, and I'd actually be able to go ahead and wear a wristwatch if I wanted to. In terms of day-to-day functionality, it's pretty much back to where it was before I broke it. I'm able to mountain bike and road bike and kiteboard and do a push-up and those kinds of things without any impairment. I'd say that the strength is probably about somewhere between 95 and 98% of what it was in the left wrist before I broke it. In other words, the strength has come back, and it's not really noticeable that the left wrist has even been broken from a strength point of view. Range of motion is something that is still decreased in the left compared to the right. If you look, you can see that I'm able to lift the right set of knuckles up more than I can the left. I am trying my hardest to lift both sets of knuckles up towards my shoulders, but that's as far as they'll go. And then bending the other way, there's also still a slight decreased range of motion in the left wrist as compared to the right, although it's not too bad. The other ranges of motion are fine in the left wrist. The only, or one of the main key things I can't do with the left wrist that I could do before I broke it is to shake my hands dry, as I mentioned before. The left wrist just still won't do it sort of comfortably like it did before I broke it, and that is actually one of the things that causes pain in the wrist, which is not that big a problem. I just use a towel to dry my hands instead. So this overall recovery I would probably describe as about 95% of what it was before I broke it, which is not too bad given that in terms of long-term effects, this is probably the worst injury I've had in 15 to 20 years of doing adventure sports. and I guess those kind of sports can result in far worse injuries, so this is not too bad overall, but it is not recovered to the level it was at before I broke it, but it is something I can live with, so I guess I'm just going to have to. Alright, hopefully that was helpful if you've suffered a similar injury, and I hope that your recovery is 100% instead of mine, which was slightly less than that. Okay.